Hi, I'm Dr. Souza from Hawaii Vision Specialist, and I will be talking to you about cataracts, potential for cataract surgery, and if you proceed with cataract surgery, what to expect. Cataracts are the blurring of our natural lens. So we start off with a clear lens, and it will become blurry or cloudy with time. There are different cataract types that you can see here on this eye model. It is located in the back of the colored part of the eye here. During cataract surgery, Dr. Driscoll will make a small incision on the front of the eye here, approximately a couple millimeters. His instruments will go into that incision through the pupil, which is just a space, and remove the cloudy cataract through that pupil. So everything is done from the cornea, the very front of the eye. Once he removes the cataract, we will then need to implant an intraocular lens. This implant is folded up very small so that it will fit into that incision. It will then go through the pupil, which is just a space, unfold once it reaches its position there. This procedure takes approximately 10 minutes, sometimes a little more, sometimes a little less for Dr. Driscoll to accomplish. You have choices as far as the implant goes. Your first lens option here is a multifocal lens. It will correct near vision, intermediate or computer distance, and distance, which is driving or TV distance. No astigmatism correction. That is the multifocal lens.
A multifocal lens can literally change the way you see. It allows for a range of improved vision, from near to far. Most patients who choose a multifocal lens are much less dependent on glasses or contacts, even if you've worn them your whole life. Just like it sounds, a multifocal lens has multiple focal points, allowing light to correctly focus on the retina at multiple distances. Just imagine seeing the world as it was meant to be seen and experiencing everything life has to offer, frequently without the burden and hassle of always depending on contacts or glasses. As with any surgical procedure, there are risks involved. Some patients still need glasses or contacts even after receiving AcrySof IQ Restore IOLs. With the AcrySof IQ Restore IOL, there may be a loss of sharpness of your vision that may become worse in dim light or in foggy conditions. There is also a possibility that you may have some visual effects, such as rings or circles around lights at night, or you may also have trouble seeing street signs due to bright lights or glare from oncoming headlights. Ask your eye care provider about AcrySof Restore lenses.
The next option is the astigmatism correcting monofocal lens, or what we call a toric lens. Monofocal means it will correct one distance. Usually people choose to correct distance, and it will also correct the astigmatism correction.
With a healthy normal eye, the shape of the cornea is spherical, like a ball. This allows light to pass through the lens without distortion. Light rays focus properly on your retina to provide a sharp image of what you're seeing. With astigmatism, the cornea is misshapen and has more of an oblong shape, like an oval, causing light to bend and distort as it passes through the lens. This makes objects appear blurry or unfocused at all distances because light rays are not focused on one spot to provide clear vision. Your astigmatism can be addressed at the time of your cataract surgery by choosing the AcrySof IQ Toric IOL. Unlike a basic lens, which will correct your vision at one distance, the AcrySof IQ Toric lens also corrects astigmatism by minimizing the effect of the misshapen cornea, allowing the light rays to arrive at one single point on the retina, providing you with clear, crisp distance vision, usually without the need for glasses.
Your third option is a monofocal lens, and notice this does not correct astigmatism, just one distance, and again, usually people choose to correct driving or television distance, which is distance vision, no astigmatism. You might ask, what is an astigmatism? You are going to go through some testing today which will tell us if you have enough astigmatism to correct with this intraocular implant lens. So please ask if you are interested in this option. Of note, insurance usually always will only cover the majority of a monofocal lens. They do not cover the multifocal lens and the toric lens. So again, let us know if you're interested in your options here, and we can talk about that a little bit more. 3 eye drops will be called into the pharmacy today. Please pick them up sometime this week, even though you will start using the drops 2 days before surgery. Bezivance or a substitution may be picked up. Note it has a tan cap. Prednisolone or a substitution may be picked up as well. Pink cap, sometimes white. And the last drop, Ilevrol, gray cap, again, a substitution may be picked up if it is better for your insurance plan. And the pharmacist will know better which to dispense. Bezivance or the tan lid, you would use that 4 times a day, evenly spaced, approximately 3 to 4 hours. Prednisolone, pink lid, same instructions, 4 times daily, evenly spaced. Ilevrol, gray lid, 1 drop, once daily. The night before surgery, please do not eat or drink anything after midnight. You do not need to use your drops the morning of surgery, but take them with you to surgery. If you wish, please take a pair of sunglasses as well. Please take your normal medications with a sip of water the morning of surgery. It is important, especially if you take blood pressure medication. Our surgery scheduler, Kalana, will call you days before the surgery to confirm the time you need to arrive at the surgery center. This time will be given to you today, but it is important to note that time may change. She will confirm with you days prior what time you need to check in. Please wear comfortable clothes as well to the day of surgery. When you arrive at the surgery center, you can expect to spend no less than 3 hours at the facility, sometimes more. You will be greeted by the staff and taken to a prep area where they will start giving you more eye drops to dilate the eyes. You will then discuss your health conditions and have a light amount of sedation during surgery. You will have an IV started as well. You will be given some numbing drops and gel prior to surgery. Once you leave the prep area for the operating room, the entire setup, procedure, and return can take between 30 and 45 minutes, sometimes quicker and sometimes longer. You will be given a clear shield to wear on your eye after surgery for the rest of the day. Please wear this shield to the office, 76 Kalaniana Ole, Hawaii Vision Specialist. That is where you will be seen by Dr. Souza, myself, before going home, so you will not need to return the next morning. Sometimes your eye will feel scratchy or you may have a dull headache after surgery. It is okay to take Tylenol or any other medications for pain that you would normally use. You will use your clear eye shield 1 week after surgery to bed so that you will not rub your eye during the middle of the night without realizing it. Eye drops to be used after surgery, same 3 drops. This may vary if you're given alternatives by the pharmacist, but this is an example and the instructions remain the same. Pre-op, day 1 and day 2 already done. That was explained on the pre-operative instruction sheet. So the day of surgery, you will notice a blacked out square under the Bezivance and the Prednisolone. That is because the surgery center already put that drop into your eye. So you must use the Bezivance 3 more times the day of surgery, Prednisolone 3 more times, and Ilevrol once. Feel free to put a check after placing the drop in the eye so you know you have 2 more drops remaining. Post-operative day 1, 4 boxes, 4 boxes, 1 box. That tells you you must use the Bezivance 4 times a day, prednisolone 4 times a day, and Ilevro once daily. You will use these 3 drops the same way for the first week, post-operative day 7. Post-operative day 8, the instructions will change, where you no longer use Bezivance. You will use prednisolone 3 times a day for 1 week, and Ilevro for 1 more week. Day 15, instructions change again. You will only use prednisolone twice a day. No boxes here under Bezivance or Ilevro. You are only using the prednisolone drop. The last week, you are using prednisolone once a day. Activities to avoid. Please do not rub your eye. Avoid strenuous activity. Avoid bending the head below waist level. Please use your knees. Do not lift more than 20 pounds and avoid any unnecessary straining, such as coughing, vomiting. Avoid swimming for at least 2 weeks. You may shower with the eye shield in place. We are trying to avoid getting water directly into the eye for at least 1 week. As far as strenuous activity and bending the head below waist level, please do not bend or lift for 2 weeks. Your prescription for glasses will change. We will check your prescription approximately 1 month after surgery to update any glasses needed for distance or for near. If you choose to purchase glasses over the counter, that will help for the 1 month prior to finalizing your prescription. You will need to see your primary care doctor or your cardiologist prior to having surgery with Dr. Driscoll for medical clearance. That will include an office visit and an EKG. If you have an implantable cardiac device, we also need to know about that, and that would usually require a visit to your cardiologist prior to surgery. If you have any other questions, please let us know. Thank you for watching this video and have a nice day.